Hi, my name is Dr. Joshua Gross. I'm a radiologist at Holy Name Medical Center, and I am the medical director of the Breast Imaging Center. Today I'm going to speak about mammography. Now, mammography is very important. Why? Because mammography has decreased the death rate, mortality from breast cancer over 30% since 1990. And that's a tremendous accomplishment, and that's because women were brave enough to come and have screening mammography, and we're able to find things early and treat them so we can help these women not only save their lives, but save their breasts too. Early detection is key to beating breast cancer. So originally we started out doing mammograms with x-ray machines and film, and then we progressed onto digital mammography, and now we've progressed onto 3D tomosynthesis, which I'll get to in a second. The idea of mammography, though, is to find a cancer early. And there's a difference between screening and diagnostic. For example, if someone has their cholesterol checked, it's not that they feel anything or something that they feel wrong, it's just they go to have a test to see if they have something. On the other hand, if someone trips and twists their ankle and you want to know if it's broken, so you do a diagnostic x-ray of the ankle. The same thing with mammography. If a woman does not feel anything, she doesn't have a lump, she doesn't have a bloody nipple discharge, and she just comes to check to see if she has any early warning signs of breast cancer, that's a screening mammogram. A diagnostic mammogram is we want to see what's going on inside because there's a problem. The problem could be that the woman feels a lump in her breast, or maybe she sees some blood coming out of her nipple. Whatever it is, she needs a diagnostic mammogram. Now the machine is the same. A mammogram is a mammogram. It's just that they came up with the idea of screening versus diagnostic in order to try to make mammography more available. In other words, the plan was by our government that women come and have mammograms called screening. And they don't stick around to have the result. They just have it done, and then the mammograms are read in a batch fashion so that we can accommodate more women faster and get more in and take care of these women. On the other hand, a diagnostic mammogram is if a woman feels something in her breast, we want to know what's going on to answer that question. So that's the difference between screening and diagnostic. But the mammogram, again, is the same. Now, the mammogram is meant to find signs of cancer. So we look for those kind of signs, and those are masses or calcifications or distortions. The mammogram itself is read by an experienced radiologist who's trained in reading mammograms. So the mammograms are done in a standard position. The idea is to include the entire breast on the mammogram picture and not miss any of the breast. So sometimes we have to call the patient back just to look to make sure we saw the entire breast. So just because a woman gets a call after her screening mammogram that she needs to come back, it doesn't mean anything's wrong. It might mean just that the test itself was incomplete. Sometimes it might mean there's something there, but of course, women are very justifiably anxious about whatever happens. So the same thing happens when a woman comes for a regular screening mammogram. It's a very scary experience. Obviously, the risks are very high. However, everyone should remember, most mammograms are normal. When we screen a population for breast cancer, only approximately 3 to 5 women will have breast cancer out of 1,000. So the odds are pretty good that you're okay. Most mammograms are okay. Now the other thing is that mammograms can be very anxious moments, not only because it's scary because of what we might find, but also because you're coming into a situation that's really not the kind of thing you want to be in. For example, you have to come in and disrobe in front of a perfect stranger. She's going to have to touch your breast and manipulate your breast into the machine so we see exactly what we need to see. So these are things that may want you to put off your mammogram. On the other hand, you'll see these are professionals who are trained to deal with you. They'll be very sympathetic. They'll be helpful to you to get you into the right position so that we can take the mammogram and get the pictures, make sure that you're okay. Now, the technologist is responsible to make sure that she has the entire picture, she has everything that's there. Sometimes we have to call women back, like I said. Now, there are different kinds of mammograms, like we said. There's the screening mammogram and done on film. Then came the digital, then came the 3D tomosynthesis. Tomosynthesis is much better at finding cancers. According to their studies, there's about 40% better detection with tomosynthesis. So you should always ask for a 3D mammogram. Now, a woman can prepare herself to have a mammogram in order to make it a better experience. The first thing to know is what is going to happen to you. But before you even come, we have some ideas for you. First of all, you should not put on any deodorant or any type of perfume or anything that might go on your, or cream that might go on your breast, because some of these things contain dense material that would show up on the mammogram as possibly a sign of cancer. So therefore, make sure you don't wear any deodorant or perfume. That's number one. Number two, one of the most important things you can do before you come for your mammogram is to get a hold of your old pictures. The best help in reading a mammogram is to have a previous mammogram so we can compare. You may have something there that's perfectly normal, but it might look funny. If we have the previous images, we can compare them for you to get your best reading. Now, like I said before, it's a little scary to come in front of a stranger. Again, these are professionals. What you can do is maybe wear a two-piece outfit, so all you have to disrobe is from your top. When you come in, the technologist will put your breast onto a flat plate and then bring another plastic plate on top and compress it. Okay, the reason why we compress the breast is to spread out the tissue so we can see the entire amount of tissue and not worry that something is being hidden by some tissue. So the technologist will slowly bring the compression paddle down, that's a flat plastic sheet, onto your breast. Of course, it's disinfected between each patient, don't worry about that. Now, the mammogram itself is not going to be fun, okay? No one ever asked for another one. But the idea is that we separate the tissue with the compression. It should not hurt. A mammogram should not hurt. It may be a little uncomfortable for a little while, but it should not hurt. Okay, also, you could maybe want to do the mammogram time into your cycle when your breasts are at least tender, so that you can come in at a time when the compression will not be as bad. The compression does not last very long, and again, like I say, it may be uncomfortable, but you may want to put this in your mind. Actually, the radiation dose is less if the breast is compressed more. The more the breast is compressed, the less radiation exposure there is. The radiation itself is nothing to worry about. The radiation that a woman gets during a mammogram is about the same amount of radiation that you get from just living on this planet for 7 weeks. So putting that in perspective, the radiation dose is very little. What holds people back is they're worried about the radiation, they're worried about the possible finding of something, they're worried about the compression, all kinds of these things. Try to get through it. You put yourself at ease. You're going to be okay, even if we find something. We know how to treat it. If you have something, no one abandons you. We will guide you to the next step to find out what it is and find the best way of taking care of it. Sometimes we just say come back in 6 months. Sometimes we have to do a biopsy, but that'll depend on the situation. And we encourage people, the patients, to talk to the radiologist. If you have any question, any comment to make about it, we want to hear about it, because we try to work very closely with you to try to make your experience one that is not so scary and not so painful, and we want you to get through it and hopefully find out that everything's okay. For more information, you can go online to holyname.org/Sharsha.